Welcome back, everyone, to the Tapping School Summit. I have a really juicy conversation for you today that I know you're going to love. This is going to be one you save, you come back to, and it's with my dear friend and fellow certified practitioner with us inside of Tapping School, Mielle Fox. And today we're going to talk about anxiety when you go to the dentist. I know it's super specific, but I know a lot of people have anxiety around going to the dentist, and I know a lot of people that use tapping for it. And so if you have that, Mielle is your woman. This session today is going to educate you, and then her bonus download is a session to take you through that. So I'm really excited to introduce you. Mielle, welcome to the Tapping School Summit. I would love for you to share with everyone a little bit about who you are and what brought you to tapping.
Absolutely. Thank you for having me. So fun. So for those of you on the YouTube channel, this is the office garb. You know, you wear scrubs all day, and when you go home, you wear pajamas and yoga pants, and there it is. So it's like the perfect blend of everything, right? So who am I? So who am I and what I do are a little bit different, but I'll just give you the Reader's Digest version. I practice general dentistry in a rural community in northern New Hampshire and live in northern Vermont, and the two states are side by side. So I basically cross the line. That's me, line crosser. Cross the line every day, twice a day. And I've done this for 30, almost 33 years. So I realize, this, this is what college does for you. Makes you look like you're 20 when you're 60. But no, I'm kidding you. It's a great career. It's a wonderful career. However, it's a career that comes with a ton of stress. It's a career that comes with stress from all levels. It comes with stress from early on in the career, going through the academics, and am I going to get a job? Am I going to work? How's it going to work out? How am I going to comes back? The anxiety, am I going to, mess things up, not mess things up? All those things happen early on in the career, which I think is normal with almost any new grad from a college, regardless of what your focus is on. For me, that then got compounded by moving to a new state, completely by myself, no family, no connections, no nothing. So that added a little bit of stress. Like many of us, I came forward to my adult life with a lot of conditioning of behaviors, patterns, thoughts, need to be enough, look enough, do enough, all the things, which over time basically shoots your cortisol through the roof and you end up in adrenal fatigue.
Ooh.
So I took a holiday for a few days early in my career where I was really cooked and burnt out. And that was a little bit of a wake up call like, oh, something's not aligned here. It took probably another, I'm going to say probably another 15 years before I actually got with the program to realize, wow, if I want to fix anything on the outside, I better start on the inside. And so I started searching. I started doing a lot of reading. I tried a lot of different modalities of, maybe I need some acupuncture, maybe I need yoga, maybe I need this, maybe I need that. Well, the reality was what I really needed was what I really gained initially with your tapping program. So I had no idea what tapping was. Um, a lot of us like shake our knees and tap our toes, but it's not the same thing. And so I stumbled over one of your short duration tapping programs, come tap with me for whatever number of days. And I had no idea. I'm like, oh, I'll check this out. Maybe it's like a dance class or something. What the heck, right? So I did, and all of a sudden I'm like, oh my God, like this is brilliant. This is like this marriage of verbal therapy with physical tapping on energy meridians. I'm like, holy Hannah, how did I not have this class in school? I could have used it then, right? So I did do your program, and yes, I'm a certified practitioner through your program. And what I discovered, apart from being able to work through a lot of my own need to regulate my nervous system, because literally I was running, like an adrenaline junkie at 150 miles an hour all the time, and I didn't really have a good way to kind of get myself back down. And the tapping is what's really helped with that. Is I realized it would serve as a tool to help some of my patients. So for probably many of your viewers and listeners, as soon as you said the word dentist, they probably like felt their blood pressure go up a little bit, or they had that instant thought that goes through the brain like, oh my God, I hate the dentist. Okay, I get it. I get it. I do get it, really. I have 33 plus years of I hate the dentist, so I totally get it, right? But I thought to myself, okay, you can take it one of two ways. You can take it as, oh my God, everybody hates me, and you can internalize it and feel terrible. Or you can say, wow, what's going on here? Like, how can I help these people? Yes, I need to help them through their dental problems, sure, but that's kind of like the mechanics of the whole gig. But what really goes on with a lot of client to practitioner interaction, if you, especially in a small community where I am, where you live with in the same community that you serve, basically. So like your neighbors are your clients, literally. So there's a lot of connection, and people tell you things, like a lot of things that have nothing to do with their teeth. So it occurred to me that I could take what I was learning for myself and find a way to bring it forward to help my more anxious patients make it through their 1 hour with me without coming unglued. And for that reason, just that reason alone, to say nothing of what else I use it for, that's been super helpful,
Wow.
really helpful.
This
Yeah.
is so fascinating to me because I don't have dentist anxiety, thank goodness. Like I haven't had anything traumatic happen. I think my childhood, my mom really made the dentist a positive experience, and I've
Mhm.
passed that on to my child, but I know that that is not the reality for many people. What are some of the things that make people so anxious about the dentist?
Yeah. So what occurs in, and this is just a very generic, broad-based overview. Everybody has their own personal story, but a lot of times what occurs for folks coming into a dental office is they're triggered either by an emotional event, something, maybe they have a scary event as a child. Maybe, the parents put the fear of God in them, saying like, if you don't behave or do this or do that, something's going to happen. There's a lot of fear involved because you have somebody who really doesn't know you, and they're coming in to your environment, and of course it looks different, smells different, and dentistry is not like anything else that you do in your day-to-day life. So there's things that go on in a dental experience that you don't have day to day. You don't have that in your office environment. You don't have it at the supermarket. You don't have it with your neighbors. Like, there are things that have to occur as a practitioner that is completely out of the wheelhouse of anything you may have experienced. And so that lack of the knowing, or the fear of the not knowing, for a lot of people is a contributor. Probably the number one contributor for dental anxiety is fear of pain. So
Mm.
there are many people who associate going to the dentist with pain. Pain because maybe they require an injection and that's scary to them. Maybe they have needle phobia. Maybe someone has hurried them through a part of the procedure, and so it's now been connected to a memory of discomfort. There's also an enormous trust issue that goes on in a dental office. And again, I share this with you because nobody tells you this. Like, nobody teaches you this in school. Nobody acknowledges and says this to you as you come in as a patient. The upside to working in the kind of practice that I work in is that, being in a rural, smaller community, we don't have to hurry people in and out. We're not the drive-through McDonald's of dentistry here. When you go in a big city, basically you're a number. You're a number and you crunch through because of the demographics. When you work in a small rural community, like I said before, your clients are your neighbors, and these people, and you want to, they're like family to you, literally. So the difficulty with the trust issue, if you think about this, is you're going to someone you don't know, and you are entrusting them to be in probably one of the most private spaces of your entire body, in your mouth. They are working 2 inches away from you. So of course you have that whole thing of that you've been taught as a child, like, stay in your own bubble, don't let anybody else in your bubble. So you have a proximity issue, you have a privacy issue, you have a trust issue, because when you're in somebody's mouth, they can't see what you're doing. So they are really giving up their trust to you. They have fear of all kinds of things. And so if you think about those pieces, all of those things, trust issues, fear issues, pain issues, memory, um, not knowing, all those things are the most common contributors and variables that spike us into our fight or flight mode, if you think about it from that perspective. And so, would it make sense for somebody to come into a dental visit kind of jacked up? Sure,
Yeah.
because you've triggered like every possible thing that can push them into the side of the nervous system that says, oh my gosh, survive, survive, survive. Sure. And so a lot of times folks come in and they're already in that presence. So it's a little bit of kind of, talking them off the ledge, just to get through what you have to get through, and rebuilding levels of trust. And it's not necessarily trust me. I mean, yeah, you got to trust me to know that I know what I'm doing, but it's learning to trust yourself, that you have the capacity within yourself to manage your nervous system to get through 1 hour with me, and you're not going to die. So,
Wow.
yeah, it makes a difference.
So this is so fascinating because I know there's people listening that are like, this woman is reading my mind. Like these are exactly some of the things that I feel when I'm going to the
Right.
dentist, and a
Yeah.
relief like, okay, I'm not the only one. I'm not alone. I'm not crazy. Like this is a
Yeah.
very common thing that people experience. So
Yeah.
what tips do you have for people that do experience anxiety around going to the dentist? And I'd love to hear like the results you've seen as well, but let's go into the
Sure.
tips.
Sure. So there's some really obvious things that I say to folks that I know are on the higher anxiety spectrum. So one of the things that I tell them is, choose an early in the day appointment if you can. Because many people who have dental anxiety, they think, oh, I'm going to make my appointment last thing of the day so I can go home and relax. But the difficulty is they spend the previous 8 hours freaking out and worrying about their dental appointment. So then they actually have an additional 8 hours to spaz and get worked up and really anxious before they show up. Or they get to that place where they've thought about it all day long. All of a sudden they get to 4 o'clock. They're like, I can't do this. And then they cancel last minute, which in itself creates just more and more and more. So my suggestion for people who know that they have issues with having their appointments, try to get an earlier morning appointment so you can just go to sleep, get up, go to your appointment, done deal. The second thing is not to disrupt or change your regular routine. Like a lot of people say, well, I didn't eat, I didn't this, I didn't that, I didn't take my medicine, I didn't. And I think, oh my gosh, you're setting yourself up for even more anxiety. We do, and this is going to sound a little silly, but it really works very, very well. Before I knew to offer things like finger bed tapping EFT, which I'm sure you have discussed or will discuss for folks, and that's also in the download that I made for you. Before I knew of that, I basically would offer my clients, both children and adult, a little beanbag stuffy to put in their hands so that they have something to do with their hands. Many people, in an effort to be the good patient, either grab the chair and lock down, they grab and hold, or they squeeze their hands like they're praying to, I don't know who, but something. And the action of doing that, if you think about that, if you were to take your hands and hold them together and squeeze very tight, you can feel the tightness through the remainder of your body. I mean, somatically, you can feel everything else tighten up. Your breathing gets short, your muscles get tight, you're tense. And when you're in that space, your body is pumping out more adrenaline to try to help you. Why? Because you're in that part of the nervous system that's saying, oh my gosh, I'm going to die. So it starts pumping out all the biochemicals to help save you. So if we can help you either through the tapping or we give you a little stuffy, it gives you an opportunity to settle. There are some people that noise is a trigger. For those folks, I suggest that they either bring earplugs or earbuds or music or whatever they want. There's a handful of folks that need a little bit more than that. Sometimes people just need a pal. They just need like an accountability partner to sit in the room.
Yeah.
And the other piece that I find, and I'll say this, and I say this with respect to all people who work in health here, because it's not an easy job to do, is we are human. We are human like you are human. We are souls in a human body. We, cry like you cry. We bleed like you bleed. We feel pain like you feel pain. We're not robotic, and we get it. Like we get where you're coming from. So patients come in and they don't necessarily want to open up or express or be, because they think, oh my gosh, she's a doctor, they must know. And so they pedestal us. And the reality is, please don't pedestal us. We're just people with a little advanced training. That's all. We just have a little more knowledge in this area. We're not magic. Well, maybe, but you know what I'm saying? I mean, honestly, it's a skill set. It's a skill set that we've been trained very specifically to do, just like you're trained very specifically for what you do. And the whole idea, like you cannot have a conversation and express yourself that's really key. So if I will say to you, if anybody out there, if you have a provider that is not willing to have a conversation with you, and that's not the same as going on and on and on about a story, but you need to be able to have a clear communication channel to express where are you coming from, what are your concerns, and what do you need, then the provider can help you. If that line of communication isn't available to you for whatever reason, that should be your ding, ding, ding right
Mm,
there. Find someone that you're comfortable with, that you align with, that fits what you're looking for. So the
that's
next piece is the finger bed tapping.
Yeah, so I just want to add in there that's so helpful because a big part of tapping is expression. You're saying, I'm anxious today. I don't want to do this. This freaks me out. I hate this. I don't like needles. And if you don't have a dentist that does tapping, having a dentist that you can just say it to and get it out. I mean, for me, that often helps. It's like, okay, y'all know that I'm nervous or like I'm,
Yes,
like I'm
yes.
not at my best in this moment. And it just brings that little wave of relief. So I love these tips. And I never thought of that, like doing the session early in the morning. So you're not building the anticipation all day, but just
Yes,
like over and done. These are so
yes.
helpful. I'll go back to you with your next tip.
Sure. So of course, many of us know the traditional tapping points are things like top of the head and eyebrow point and under the eye and under the nose and under the chin. Well, obviously, if you're having your dental work done, that doesn't really work very well because we're in each other's space, and that doesn't help too much.
Yeah.
So I created the download that people can do prior to going to their appointments. But
Okay.
when you're physically in the office, because you can't be all over your face, because I'm all over your face, the finger bed tapping is really amazing because it allows you to tap through the meridians associated with the beds of the fingers. So you can still do that while I'm doing your work. That motion that you did of rubbing the back of your hands and palms, that anything that is allowing you to stimulate the nervous system and channels that run through our body in a way that is calming and soothing is the thing you can do. And your hands are in your lap, usually, unless you've got my stuffy in your hands. Um, for some people, they like to put their hands in their pockets, whatever. But even that, even if you have one hand, you can actually one hand finger tap if you need to, for sure. And I just think to have that ability is like having a tool in your pocket. And it doesn't require anybody else. And nobody needs to know if you're worried. No one needs to know that. But it
This
gives you a way to work through.
This
Yeah.
is a really good point. We've referenced finger tapping, but I haven't showed it yet.
Mm,
So for those of you that are like, hey, what exactly are they doing? I'm just going to show you. So it's tapping right on the side of the nail bed. And you kind of get this rhythm going. You're just filtering through one finger at a time. You're going back and forth, back and forth, back and forth. And there's not like, you don't have to do it perfectly. There's no like perfect amount of taps. You just start tapping on the side of the nail bed, or you can tap on, like sometimes when I'm driving, I'll do this. I just use one hand and like, not that I'm recommending tapping and driving, but I'm saying for myself personally, sometimes I just do this. And the other thing that you brought up was like, people do, like now that you say it, I think I do really grip my hands when I'm getting my teeth cleaned. Like to me, it doesn't hurt, but I've never noticed it till you said it that I'm like this, gripping myself. Like when
yeah.
I'm, oh, I've never put that.
Yeah. So, well, there are two major reasons people grip. One is, the chairs are okay, but they're not amazingly comfortable. And it's hard to find a place that you can rest your arms and relax because of the angle of the chair makes it difficult. And then usually you're laying kind of upside down, which means, again, it's difficult to find a place to put your hands that feels comfortable. So many people hold the other hand because they're trying to keep their arms still and steady. And as soon as you put your hands together, there's that almost innate reaction to apply pressure and squeeze your hands together so that
Yeah.
they don't go anywhere. So it happens without even realizing that it happens.
Yeah.
And the other thing that I would encourage you to just think about the next time you go for your regular recall visit, your cleaning visit, is see if just holding your hands together is because you have nowhere else to put your hands, or do you find yourself actually doing that in an effort to try to lay still, try to hold yourself steady in some way. Because
Yeah.
the reality is when that's occurring, everything's tightening up, everything's tensing up.
I
It
think
just,
when I think about, I'm like, now I want to tap on this because when I think about why I do it, it's almost like a perfectionist thing. Like, it's like when I was a little girl, it's like lie there and be still and do what he says. Like, I feel like it's almost like a reverting back to like, okay, am I doing it good enough? Like, like, am,
right.
am
And
I?
and people come in with that. Am I laying still enough? Is my mouth open enough? Do you need me to move my tongue? And here's the kicker. We're trained to work around whatever's going on. So when you come in, the only thing we need you to do is breathe, literally. Like we'll do everything for you. It's okay. That's part of the deal of it. It's a little bit like if you went to have a manicure and the gal says, "Oh, just come on in and have a seat and put your hands in the little soaky bowl." And you're like, "No, no, no, let me get the nail clippers and trim them for you and let me do this and let me do that." She'd be like, "No, no, 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 really, don't help me." So we're a little bit like that. We're like, "Yeah, okay, got you, boo. Don't help us, okay?"
You totally got it. Oh, I love that. And it also brings up another tip that might be helpful. I remember one time I had to get an MRI and I had anxiety about it because I never had one before. So I didn't, and I heard other people had anxiety about it. So I was like, should I have anxiety about it? Like I didn't know what to expect. And at the time, I was just taking my tapping training, and my tapping teacher said, you can, as you're going through it, like in the MRI example, imagine yourself tapping through the points because I
Yes,
couldn't move my arms or my hands.
yes,
And it was done in like a blink. I was like, oh, because I was just so focused on like, if I
yes.
was tapping right now, I'd be like top of the head, side of the eye, under the eye. And then I was like, oh, I
Yes.
didn't get through it. I'm
So
done.
here's the other piece of that, Jackie, is that if you think about it, I'm sure people have heard like, oh, when you tell somebody your story, like let's say, I don't know, let's say you had road rage, right? And you tell your BFF about your road rage. And in the telling of the story, the road rage comes back up. That you had in the moment as you retell the story happens again. And why? Because your body doesn't know any different. It just repeats that pattern again. So if you take that and extrapolate it to your example, if you are in your mind visualizing yourself tapping and saying the verbal language and you're picturing yourself tapping the points, your body doesn't know that you're not physically tapping the points in the moment, so to speak. And so what it provides is the means by which you can self-regulate even though you don't necessarily have the physical piece of it in that moment. It's not quite the same, but it's pretty darn close.
Yeah.
Um, and so that is also I've actually suggested that to patients because of course they're upside down, which again is a very it's a very vulnerable position for people to be in. They don't love it. It's not like you go somewhere else and they go, "Hey, can you lay down flat and upside down, and then I'm going to hover over you 2 inches from your face," right? That's not really normal. So when I say to them, the two things I really would like for you to concentrate on is your breathing. And we actually do breathing demo before I start anything so that people really get the idea like you need to expand your lungs, you need to get the air in and out. And just by virtue of that, it is going to bring your anxiety level down by getting more air into your lungs. And then I've actually walked them through, in your head, you can be saying these things and visualize yourself doing these things and it will still help. So
It's
it's a great suggestion.
Yeah,
Really
it's
good.
almost like like the practice of doing that distracted me from what was going on, and it
Yeah.
changed my emotional state because I was so focused on something else. I was like, okay, I'm gonna tap in my mind right now. So if I was to do that, I go top of the head, I go eyebrows, side of the eye, that I forgot. Like, yes, I could hear the thing, but I was like, I was so focused on something else that it changed my emotional state. And so thank you
Absolutely.
for bringing this conversation up because I kind of forgot about that.
Yeah.
And it really does help. Like this is, I know that people are like, oh my gosh, I feel so seen and heard. And like, this is so helpful. And the other piece that you said, going upside down, I've had vertigo in the past, and that used to be a fear of mine. Like when I come up, am I going to be dizzy?
Yeah.
And I just say to my dentist, like, sometimes I'm dizzy when I sit up, and they're like, we'll just take you up slow. And you'll
Yeah.
sit here for 10 minutes or however long you need. And I was like, oh, so all of a sudden my whole body regulated because again, I could express my fear.
Yeah. So again, it's really key to have that open conversation with whoever, whether it's your hygienist or your dental provider, whoever you're seeing, to just, it's having any other normal conversation. Like
Yeah.
if you were getting in a vehicle and you're afraid of somebody going too quickly or turning too quickly because it makes you dizzy, you might say to them, could you not turn quickly because it makes me too dizzy? Same
Yeah.
thing. You come into your dental office, could you not raise the chair so quickly because it makes me feel dizzy? It's
Yeah.
the same thing. So that communication is pretty significant.
Which
Yeah.
opens up like this whole other conversation, which I know we could get into later, but is like self-expression for women. Like I find a lot of women hold themselves back from expressing out of fear of like messing up, not being perfect, not being accepted. And so like preliminary
Judgment.
testing with you in this way is really going to help you find your voice and your power and safety in starting to use your voice.
Yes. And I will say it's a little gender stereotype, but I will say that as a female provider in a predominant, well, nowadays it's not, but it used to be a predominantly male dominated field. Much much more even now, more female practitioners. When I first got out of school 30 some odd years ago, there were not very many women. It was mostly men. And for a woman to come into a medical facility and then have some guy 2 inches from her face, we've been taught as women to kind of put up and shut. And so that anxiety builds because of that. And that fear of, am I going to be judged as being, a weenie or weak or whatever the thing is, it escalates a lot in certain environments. And so to understand you can use your voice, especially for our female population, is really important. That you're not judged. It's a judgment-free zone. Our job is to offer you oral well-being, and it doesn't make a difference to us who you are, what you do, where you're from, nothing. It's got nothing to do with our job of what we do. And I think we bring those things with us. Everybody does.
Yeah.
Everybody does. And it's grilled into you from a child. Like, make sure you have clean socks and underwear because God forbid if you end up in the emergency room, you know what? If you were actually down in the emergency room, they don't care if you have poo-poo pants.
Yeah.
All they care about is that you're not dead. And why do your parents tell you that? Because they're afraid they're going to be judged for not putting their kid in clean panties. It's got
Right.
nothing to do with anything.
It's
Right? But
true.
that's what we're taught. That's what we're taught. And
Yeah.
it
And
carries forward. So,
it's
yeah,
so true. Those little stories are sitting in our subconscious. And as you know, as you tap, they start to come out and you can heal them. You can release them. I'm so grateful for this conversation today because this is a really practical thing that people feel and experience. And I know that the resource that you're giving them this conversation, like bookmark this, send this to a friend, save this. It's a lifesaver, honestly. Like, we need more people knowing that these tools exist. So, you and I have had some really great conversations together, specifically on your podcast. I really would recommend everyone going and listening to the podcast. Can you share with everyone a little bit about what they can expect over there and what you talk about?
absolutely. Absolutely. So, and by the way, your podcast is now up on Spotify. So your episode that we did. So woo woo woo. So I love what I do with my day job, but I really feel like there's more. There's just more for me. There's more for me to share. There's more for me to do. So I created a podcast called Energy of the Untamed Heart. And the basic gist of it is I want people to be seen and heard and understand they're not alone in their journey to walk themselves home to their heart, and that all of the things we tell ourselves and believe and or we've been conditioned to are truly just uh, filters, masks, barriers to the true essence of who we are deep down in our core, which is pure love, pure joy, expansion, and love.
Mm.
And if we can gently find a way to remove those barriers and really tap into what we were here, brought to this earth as, which is love, then you can lead a life of anything that you desire, anything that you want. And so the podcast, it's a little bit of guest episodes and solo episodes where I just get on and jibber jabber. And it's basically to just address that, see that, talk about that, and allow listeners to feel heard. Yeah,
Ah,
it's
I love
fun.
I love talking with you. I love your conversations. You're so fun to listen to. You have really practical tips to share. So I highly recommend everyone go and listen. So it's The Energy of the Untamed Heart. Is that correct?
Yes.
Yeah.
Yes, ma'am.
And
Yep.
so let's say Instagram, Spotify, Apple, all the places they can find it.
Pretty much. I'm waiting for Apple to say yes. So Apple has been proposed to, but has not agreed to say yes yet. But certainly Spotify, iHeartRadio, Amazon Music, like all of your listening platforms, Podbean, all of those. Just type in Energy, the Untamed Heart, and it'll pop up. Yeah.
Amazing. And then you're
Yeah.
also on Instagram too. Is that correct?
Yes, I'm on Instagram and Facebook under my name, Mielle Fox. And I also run a Facebook group and a website under Fox Den Energetics,
Mm.
where we kind of talk about all the things numerology, tapping, coaching, life, blogging, all the things. Yeah,
I love
everywhere.
all the
Yeah.
things. So
Yeah.
I want everyone to make sure go and follow Mielle over on Instagram, check out her Facebook group, listen to her podcast. I love, love, love my conversations with you. Thank you so much. And then most
Thank
importantly,
you.
after you listen to this, go and download the resource. Do you want to just give everyone a brief snippet of what's in the resource for them today?
Absolutely. So I made a really quickie, like, here's something you can do at home before you go to your appointment so that you can use all the typical points to talk about. And I also talked a little bit about finger tapping. I talked a little bit about what one can expect so that it takes the edge off of, I don't know what's going to happen. So
Mm,
it's all in there.
it's
Yeah. Feel
so
free to reach out. Happy to help.
Yeah, reach out and go download it, save it. It'll be something you'll use and send to a friend. I know people who have anxiety around going to the dentist. I'm going to send it to them.
Yeah.
Thank
Yeah.
you so much, everyone,
My
for listening to
pleasure.
our conversation. Thank you, Mielle. I love you, and we'll see you next time.
You got it. Thank you.